Hello and welcome to this recorded webinar on clinical placement models. My name is Lucy Zuman and I am joined by my colleague Natalie Ellis. We are both clinical educators with Three Rivers Department of Rural Health at Charles Sturt University. I am located in Orange, New South Wales, and my professional background is speech pathology. Natalie is located in Wagga, New South Wales, and her professional background is nursing. Natalie and I will take turns presenting this information, which is all about the different clinical placement models. This information is relevant to clinicians taking on students in rural practice and for students who wish to understand more about the types of rural placements that may be on offer to them. Firstly, I would like to acknowledge the Wiradjuri people, who are the traditional custodians of the land on which we are presenting from. I would also like to pay respect to the elders, both past and present, of the Wiradjuri Nation and extend that respect to other Indigenous Australians who are present.
Charles Sturt University Three Rivers Department of Rural Health is based in the Central West and Riverina region of New South Wales. Our goal is to improve the recruitment and retention of nursing, midwifery, allied health and dentistry professionals in rural and remote Australia and work with educators, healthcare providers and local communities across our footprint to support students, health students and rural health professionals. The Three Rivers geographical footprint goes from Coonamble in the north of New South Wales all the way down to Albury on the border of New South Wales and Victoria. The Three Rivers Rural Health Education Team coordinates several innovative placement models. We consider the core values of social accountability, quality learning and teaching, and rurality when developing, delivering, and evaluating placements. Our team designs these placements in collaboration with an organisation's staff and the local community to achieve mutual benefits. We also work closely with university workplace learning coordinators to ensure that these placements align with students' learning objectives while offering a unique rural experience. In today's webinar, you will have the opportunity to develop an understanding of the types of clinical placement models and their differences, identify the variations in learning outcomes across clinical placement models, understand the benefits of various clinical placement models for students and for the organisations they work in. Identify the type of clinical placement models specifically supported by Three Rivers Department of Rural Health and gain an understanding of the types of projects that can be completed in non-traditional placements. And you will understand how the Three Rivers supports students and supervisors on clinical placements within our footprint.
Before we deep dive into the placement models, let's revise what clinical placements actually are. Clinical placements are a mandatory requirement for all health degrees offered in Australia. They enable the integration of theory and knowledge into professional practice and enable the development of clinical skills, critical thinking, and problem solving. The placement structure, timing, and duration will vary according to the discipline and the university. Specifically, a clinical placement is time spent in the actual professional working environment that a student may be employed in post-graduation. It develops discipline-specific clinical skills, critical thinking, reflective practice, and problem solving. Clinical placements also allow for socialisation and immersion in the student's future career. Clinical placements are important to practice and embed students' skills and academic learnings in a supported and safe environment. They will have one or more supervisors who are able to provide real-time feedback and support to prompt reflection and critical thinking. As outlined by Edwards et al. in 2004, clinical education through placements can influence student development of professional identity and practical knowledge and skills brought about through professional socialisation and practice. In addition, clinical placements are crucial for the development of clinical competence, clinical confidence, time management, organisational skills, and preparedness for independent professional practice. Generally, placement expectations tend to be short and observational for first and second year students, and are then longer in duration in third and fourth year, where expectations rise to a graduate level. From our perspective, in rural locations, clinical placements can significantly influence recruitment and then retention brought about through exposure to practice in rural regions. Many regions and organisations are now adopting a grow your own mentality, assisting with workforce building and renewal.
As you can see, there are a host of benefits related to student placements. Many of these are particularly significant for the rural context. To highlight a few, for students, placements provide opportunities to develop clinical and cultural competence. They help broaden their horizons and may lead students towards a potential employment location. For supervisors, having students is a great way to enhance your own skills and maintain best practice. For organisations, hosting students could assist to maintain quality standards and build their workforce. Building the rural health workforce is the main reason why university departments of rural health and rural clinical schools exist today. The rural health workforce remains a nationwide priority and a significant challenge currently. Communities benefit by having increased access to services to address their healthcare needs. Universities and university departments of rural health work hard to allocate students to rural placements for their clinical practice in an effort to expose students to rural practice and support recruitment to rural areas. In many instances, universities identify students through an expression of interest process to try and ensure that there is a good student to organisational fit. Benefits of these placements include activities or projects that add value to current services or enhance service capacity, improved consumer and population health outcomes, enhanced organisational learning culture, improved relationships between universities and staff, professional development for staff, and enhanced visibility of the organisation for recruitment of future health professionals. So let's find out more about the type of placement models that health students can experience rurally. There are two main categories that clinical placements fit into. The traditional placements, where there are a variety, and there are a variety of non-traditional placements. We will look at two specific models today. The traditional clinical placement model is the most common placement provided to students and is thought of as an apprenticeship model, where your learning is one-to-one from an experienced mentor on the job. The clinical educator structures the student learning experiences and provides direct supervision and role modelling to the student throughout the course of their placement. The degree of supervision and the amount of responsibility given to the student will vary depending on the context of the placement and the year of the student. The traditional placement model is a patient-focused model where a student will directly interact with patients or clients under the direct supervision of an educator of the same discipline. This type of placement occurs in various recognised and approved clinical settings. Students benefit from the individual focus and guidance provided from one educator, and it is a valuable learning model, particularly in the early stages of training. There is some limitation for the student as they are somewhat dependent on the educator to facilitate their learning, and this can be limited by the educator's capacity and what they can provide the student one-to-one. Additionally, there is limited opportunity for collaborative or peer learning.
There are a variety of non-traditional placement models available to students, including the interprofessional learning model and the service learning model. To work in rural clinical practice, clinicians need to be adaptable and use a broad set of clinical and non-clinical skills. Non-traditional models promote the development of these skills through independence, reflection, research, collaboration within multidisciplinary teams, and immersion in rural communities. The focus is more on the organisation itself as opposed to direct client or patient interaction. Interprofessional learning placements take on a team approach and are focused on opportunities to bring students from different disciplinary areas together to work as a team. Placing students together in a rural area and promoting a team-based approach to placement enables a shared team identity, interdependence and integration, and a shared responsibility for care. These placements involve student orientation, work and evaluation occurring together, and the opportunity to learn from various health professionals. Interprofessional learning promotes work readiness, teamwork and communication, and encourages collaborative healthcare with patient-centred goals. The complexity of setting up these placements and encouraging clinical supervisors to take on the multiple students at once can be challenging. An example of interprofessional placement that Three Rivers clinical educators accompanied was an interdisciplinary group of undergraduate health students conducting health screenings for rural men at the Henty Machinery Field Days. Over the 3 days, the students spoke to hundreds of men, measuring their blood pressure, body mass index, and waist circumference, and discussing diabetes risks and age-specific health screening requirements using the Spanner in the Works model, targeting open conversations about men's health. The paramedicine, physiotherapy, and occupational therapy students worked alongside the Australian Men's Shed Association to learn how to engage with rural men and have an honest discussion about their health. Service learning in health sciences connects academic learning with real life situations and looks at the other side of clinical intervention. The client is not an individual, but the organisation as a whole, which allows students to develop critical thinking in a safe and controlled manner. It enhances their knowledge of different populations and patients and their understanding of social health determinants. An allied health professional may or may not already be working at the host organisation. If there's not, the student is supervised on site by a suitably trained professional within the facility, and then once or twice a week by an off-site discipline-specific professional supervisor. Service learning placements allow students to become fully immersed in a rural community. It broadens their understanding of their professional role and enhances work readiness by promoting independence, clinical reasoning, project management skills, and interdisciplinary communication. They are created in consultation with host organisations so that they can meet pre-identified community needs. The purpose of the placement is for the student to provide a service or complete a project that can be continued once they have completed their placement. Some students may be concerned about the lack of hands-on clinical practice, and there is an expectation and purpose to the placement, which can be overwhelming for the students and supervisors. Some project ideas on a service learning placement could include the development of a new or existing program for a group of clients, creation or assessment of a new or current resource kit, training handbook, or educational package. Students could conduct a survey or audit within the organisation, or they could analyse specific activities or evaluations in the workplace. A project can be presented in a variety of ways, through resources or programs for health professionals and educators, a resource toolkit for parents and children, booklets and brochures, a PowerPoint presentation or a video, and a written report. So here are some recent examples from Three Rivers service learning placements. For a paediatric caseload, Within a public school, physiotherapy students created a toolkit for physical development of kindergarten students. Occupational therapy students created a sensory processing program in an early learning centre. And in a public school, speech pathology students created an information booklet for kindergarten teachers on the speech pathologist's role in supporting the communication skills of kindergarten students. For an adult caseload, occupational therapy students presented a business case for the employment of an occupational therapist at the Aboriginal Medical Service. Physiotherapy students created a manual handling toolbox for staff in an aged care facility. And speech pathology students created a safe menu guide based on the International Dysphagia Diet Standardisation Initiative in a nursing home.
There are a number of factors that can influence the quality of experiences students and supervisors have during placement. So we offer a variety of supports to enhance your experience. Three Rivers provide various grants and scholarships to eligible students for financial assistance to cover costs of a placement or support study-related activities. We also offer accommodation and scholarships for accommodation for eligible students. We have clinical educators who live in various locations across our footprint who facilitate and support placements. We offer training and supports to help students and supervisors look after their own mental health during placements. The Rural Health Positive Club, RH+, aims to unite undergraduate health professionals from all health disciplines to promote opportunities in rural and remote practice. And we offer fortnightly virtual catch-ups to students on placement, which provides a safe space to connect and debrief and support each other. At the Three Rivers Department of Rural Health, we have a range of professional development opportunities. We have other recorded webinars on a range of topics, live webinars and face-to-face events. We also have a suite of online modules for both students and clinicians that can be completed in any order at your leisure. You can find all of this and more at the Three Rivers website, www.threerivers.csu.edu.au.
Thank you for your time in viewing this recorded webinar on placement models. Could we please ask that you complete the evaluation to receive your attendance certificate? Registering attendees will receive a certificate on completion of this evaluation, which is found on the same page that you accessed this recording from. On a final note, if you would like to supervise students, if you're not already doing so, or would like to suggest other professional development needs your organisation may have, please get in touch with us.